We're on to learning unit number 6. It's incredible how quickly things are going. So, in this unit, we continue with our own individual resiliency practice, as well as now we're also going to look at systems thinking. And we're going to look at both systems thinking and design and how organizations can prevent and mitigate burnout in their healthcare workers. And specifically, we're taking a systems approach to professional well-being and resilience by looking at high reliability organizations along with the work of the National Academy of Medicine. They have a collaborative on clinician well-being and resilience, and the work of the CDC's NIOSH. So we're going to explain that in a minute. And by the end of this learning module, you're going to be able to propose how high burnout rates among healthcare workers truly demonstrate a failure not of the individual healthcare workers, but a failure of our healthcare system to meet its goals. And that's a powerful statement, truly. And we're going to discover work systems that facilitate teamwork, collaboration, communication, and professionalism that nurture organizational resilience. So you're watching this video as you have in previous weeks. You're completing your 3 good things journaling. You're completing your heart rate variability biofeedback practice. And you're reviewing information that's going to really focus on a systems approach to building resilience and well-being instead of putting the focus on the individual that they are responsible for building their resilience. And we know as we're practicing these individual resilience building techniques and modalities, we know that that is indeed helping helping to build our well-being and resilience. But it is so interesting to see how we're going to change our viewpoint a little bit so that we start with healthcare organizations and systems being responsible for building a culture of well-being and resilience, and then how the individual practices will then further evolve and follow after that beginning look at systems. So hopefully I'll explain that a little better as we go along here. You're going to complete your discussion board 6. You are not going to need to reply to a classmate's post. I will take that out. You will not reply to a classmate's post unless you want to. I want to give you a little extra time to submit your StoryCorps interview, which is due at the end of this learning module. So here's your folder that is very similar. You've been practicing every single week so far. You know what to do. Here is from, this is just a primer. So it's a link, but it's a short section of information from AHRQ, from their Patient Safety Network, really helping us to get a foundation. What is a high reliability organization? So it's a shorter amount of information, but we'll be coming back to the site quite a bit during the summer course in Nursing 573. So I do ask that you read this because you're going to need to really be able to describe a high reliability organization, HRO. And resilience starts with HRO. So I think you're going to find this article to be very informative. Resilience starts with healthcare organizations. With this in place, individual resilience will follow. So starting with healthcare organizations, then the individual resilience will follow. And the next is the National Academy of Medicine, and it is a brief and it's on the role of healthcare leadership. So when we say organizations, we don't mean um, uh, organizations, what we do mean is organizations include people, right? So when we look at organizations, we're really looking at healthcare leadership from the highest level down, and what work systems are developed that that help prevent um, clinician burnout, and how these factors can contribute to professional well-being. So the National Academy of Medicine, you can read through these. That is the formerly called Institute of Medicine, the IOM. So the NAM is one of three academies that make up the National Academies of Sciences. And that is, or I'm sorry, it makes up the National Academies of Sciences, Engineering, and Medicine in the U.S. The National Academies are private, not-for-profit institutions that work outside of government to provide objective advice on matters of science, technology, and health. So this is very important distinction that we recognize, that the National Academies are private, nonprofit institutions. The next, of course, is the CDC, the Center for Disease Control and Prevention. Their branch, called the National Institute for Occupational Safety and Health, NIOSH, NIOSH. NIOSH promotes productive workplaces through safety and health research. They have just recently developed and designed a guide to help healthcare leaders and executives, those in the C-suite, to accelerate or supplement professional well-being work in their hospitals at the systems level. So this is again a link. I want you to go on, read the information on what is entitled the Impact Wellbeing Guide. And then please do take a moment to explore the guide's 6 actions. They have 6 actions that they focus on, and there's more information on each one of these actions when you click on. So we have the non-for-profit, NAM, working outside the government, and we have the governmental institution, the CDC, that are really looking at systems level well-being and resilience building in healthcare organizations. So our discussion board, our readings for this week can be summed up by this sentence: resiliency starts with high reliable healthcare systems. So resiliency starts with a systems approach. Individual team member resilience will follow. So citing from the readings, and you don't have to go to additional readings, citing from the assigned readings web pages, please demonstrate what evidence exists that supports the statement. So you're going to help us better understand where the statement comes from and what evidence truly supports that statement. And then you're finishing and submitting your resilience praxis assignment, which is your StoryCorps. And I look forward to hearing those and listening to the wonderful work that you have done as you interviewed your resilient nurse.